So when we walked in this morning, we saw a family with balloons and signs, and all of a sudden a gong went off. Tell us about what that was. And we saw a lot of the staff all around cheering. I'm sure it was a success story.
Well, it's one of the most anticipated days of any patient who starts their therapy here, and the gong ceremony signifies the successful completion of a course of treatment, whether it's radiation or chemotherapy, here at the Hayworth Cancer Center.
Tell me more about the patient navigators. I've heard so much about this.
Once a cancer is diagnosed, patients and their families can feel lost.
When a patient's diagnosed with cancer, specifically in my case lung cancer, then I'm available to help them get connected to those resources, the Love Line funds, through our social worker, the Insure program, through our dietitian. There's other resources that I'm available to help them get connected to as they go through their journey with lung cancer. What we do as navigators gives the patients comfort, relief, and reassurance that someone is there to help them through this diagnosis of cancer.
Not a day goes by that I don't meet someone here whose father, sister, or other relative received treatment at the Hayworth Cancer Center. And the reason they're here is because of the wonderful care that their family member or their friend received. And that's a responsibility that we take very seriously, and we work very hard to fulfill and grow that.
High Point Regional Hospital is the first hospital in the Triad area to use this form of energy to treat atrial fibrillation. For many years, the principal form of energy that was used to treat rhythm problems with ablation, where you damage the tissue, was radiofrequency energy, which is a form of cautery delivered through the tip of small electrodes on catheters placed in positions in the heart. There was interest in using freezing energy or cryo energy that was approved in 2010, and it became available for use to treat a rhythm called atrial fibrillation. And we have had people come to High Point Hospital looking for this procedure.
How are the patients doing so far?
So far we've done 2 patients and everything has gone smoothly, and as predicted, the cases were short.
Well, we actually have a surprise for you today.
And what is that?
Here we go.
It's good to see you. Good. How about you? I'm doing great. We are in a new lab here that was built on contributions from people who support the cardiovascular service line at High Point Hospital, and this is helping the electrophysiology section of the cardiovascular line to grow.
High Point Regional is no question on the cutting edge of minimally invasive technology. For instance, the Da Vinci robot, and we're one of the leading centers here in this region, in the Triad, of developing these minimally invasive techniques.
Really what the robot does is allows us to control those instruments in a very refined manner, than with a lot more skill than we can do with our own hands. Which means patients get back to work sooner, get back to their life sooner, and outcomes are as good, if not better, than previously.
These single-site surgeries, there are very few centers that are offering that in North Carolina, let alone this region. But one of the integral parts about that has been the community support, in particular individuals like David Hayworth, who have stepped up and really pushed our program to being one of the state-of-the-art programs, and allowing us to perform these minimally invasive techniques and really being a leader in this area. Essentially, working at High Point Regional has really felt like this is my home away from home. This is my community hospital. I live in the community. I see my patients all over town, and I've taken a lot of pride in being associated with High Point Regional, because I feel like we deliver great care to the community, and that's what I'm glad we're known for.